Good afternoon and welcome to this bill hearing of the House Health Committee. I'm Chair Bagnall here with our amazing Vice Chair Cullison. We are going to get started right now. Please forgive us if we have any technical issues. We are streaming live on the Maryland General Assembly YouTube channel. We are, I believe, sponsor only for most of our bills today. So just a reminder that sponsors are not time limited on your testimony, but keep it within reason. And any witnesses have 2 minutes. There is no food and drink allowed in the gallery, but please be aware that our delegates often have drinks at their tables because their desks, because our bill hearings can run quite long. If you see that we are missing members, they are also have bill hearings over across the street and are having meetings to make sure we get all of our work done before sine die, but they are staying apprised of our proceedings. Today, we're going to take our bills in the following order, again, subject to the availability of the bill sponsors. So Senate Bill 742, followed by 412, 656, then 579, and then 714, 820, 892, 412, 866, 159, and 898. And so we are going to go ahead and start with Senate Bill 742. This is Maryland Medical Assistance Program and Developmental Disabilities Administration Home and Community-Based Services eligibility. And remember that if this is a cross-file, you are welcome to say that it's a cross-file and if it is in the same posture. So thank you very much and welcome Senator Zucker.
Thank you so much, Madam Chair, Madam Vice Chair, distinguished members of the Health Government Operations Committee. I am Senator Gazzoni's stand-in today, and part of that is not only the importance of the bill, but I wanted to personally come in to salute Vice Chair Bonnie Cullison, one of my dear friends, and I would have put in any bill in order to see her one last time in this committee. Madam Chair, colleagues, you already heard House Bill 1445, Protecting Marylanders with Disabilities Act. There are some amendments that are agreed upon by the administration. As amended, there's no opposition, and thank you so much for your time, and would certainly ask for a favorable report as amended.
Thank you very much for your testimony. Are there any questions for this witness from the members? Vice Chair Cullison.
Thank you, Madam Chair, for your indulgence. I just want to thank Senator Zucker, who has a great deal to do with my being here back in 2010. He was very active in helping me to learn how to be a candidate. So I thank you for that and for this opportunity.
It's my honor.
Seeing no other questions, thank you very much for your testimony. This does conclude the bill hearing on Senate 742. We are now going to go to Senate Bill 412, Maryland Department of Health Forensic Review Boards and Community Forensic Aftercare Program. Senator Augustine, if you want to come to the table and give us your testimony.
Okay. Thank you, Chair Bagnall, Vice Chair Cullison, members of the committee. Senator Malcolm Augustine here on behalf of Senate Bill 412, which is very, very close to House Bill 658. There is only one difference, which is actually on page 7 of the bill, where in the Senate we have language that prevents the CFAP monitors from providing clinical decisions. This was done in concert with the variety of stakeholders, keeping the patients in mind. Madam Chair, I will say I also did receive some amendment language for Senate Bill 412 just prior to this, and I just would say that I think that the amendment language that was shared with me that deals with the issues and concerns that we had, and I want to thank you for your engagement on this bill. I mean, I'm really grateful for that. That dealt with the court orders. I think it really does take care of that. I think that's fantastic. And also just, again, getting back to the heart of what it's trying to do was to observe and to monitor. So the language in the Second Amendment that does that, I think really strengthens the bill, and I would be grateful with the amendments that you all put on passing this bill.
Thank you very much for your testimony, and thank you for jumping onto a call first thing this morning while we were trying to figure this out ahead of the bill hearing. Are there any questions for the sponsor? Seeing none, thank you very much for your testimony, and this concludes the bill hearing on Senate Bill 412. We're now going to go to Senate Bill 656. This is the Crown and Care Act protecting communities from harmful hair chemicals. Senator Henson, if you want to go ahead and come to the table and give us your testimony. Welcome.
Thank you, Madam Chair, Madam Vice Chair, members of the committee. For the record, Senator Shanika Henson on behalf of Senate Bill 656. Thank you all for passing the cross-file of this bill and for adding some really thoughtful amendments to the bill. Those amendments would add lead to the list of prohibited chemicals. It also shifted administration of the restitution fund from the Office of Attorney General to the Department of Health. Those amendments, I do think, make the bill stronger. Additionally, in addition to that, after having conversations with the Office of the Attorney General and the Department of Health, I would propose 2 additional amendments for your consideration. One would be to change the name of the restitution fund to the restoration fund. And speaking with the AG's office, what they've indicated is that restitution is a legal term of art that has some significance that would require them to administer it in a particular way. And so if the name is restoration fund, it would give them more flexibility to craft the administration of the fund in accordance with their existing practices. And then second, there's some prescriptive language in the bill that passed over from the Senate that has the administration of the fund being done a particular way. The Senate version does have the original language, which has the Office of the Attorney General. So that would need to be changed to be amended to your language, which has Department of Health. But additionally, in speaking with the House bill sponsor and both the OAG and the Department of Health, we would propose some language that would task the 2 departments with coming up with a plan for how to administer the fund instead of having the bill pass with language that was prescriptive on administration of the fund. That way, it would require them to adopt that language by regulation, and then if we wanted to come back in a future year and codify that language, we could do that, but they would have the flexibility through the regulations that they adopt to administer the fund in the best way that's possible for the 2 offices that would be tasked with it. Of course, the OAG will be doing the enforcement and compliance portion, and then MDH would be doing the administration of the fund. Otherwise, I thank the committee of your thoughtful consideration of this. I'll let you know anecdotally, I was in a beauty supply store just this weekend, and these harmful and toxic chemicals remain on the shelves. They are labeled clearly that these are the chemicals that were banned in Maryland, that were passed into law in 2021, that went effective in 2025, and they are still available for sale in our beauty supply stores, and we understand the harmful effects of these products. So with that, I will leave it in the committee's careful consideration. Thank you.
Thank you very much for your testimony. And thank you for continuing to work with the stakeholders and with our House cross-file. Are there any questions for the sponsor on this bill? Seeing none, I just wanted to clarify the language around administration of the fund, working with the department. That came from the department, is that correct? Or at the suggestion of the Department of Health?
Yes, that was with the Office of the Attorney General's office.
Okay.
We discussed that, and that is in the written testimony that I provided to the committee.
Okay, thank you very much.
Thank you, Madam
for your
Chair.
testimony.
Thank you, colleagues. Thank you.
Thank you for this bill. This does conclude the bill hearing on Senate Bill 656. We are now going to go to Senate Bill 579. This is counties no-cost preventive cancer screenings for volunteer and retired volunteer firefighters. Senator Jennings, if you want to come to the table and begin your testimony.
Thank you, Madam Chair. For the record, Senator J.B. Jennings for Senate Bill 579. This is a cross-file of House Bill 1602. Unfortunately, that bill was stuck in rules. I think it was filed late, so it never made out of rules. Quick review of this bill, since you have not had the chance to hear it. If you remember last year, you had the Jimmy Malone Act of 2025. What that did was it allowed for cancer screening of career firefighters. This continues that to volunteer firefighters. You know, geographically, roughly 70% of our state is protected by volunteer firefighters. Unlike career firefighters, you know, they don't have health insurance through the volunteer system. You know, most of them have jobs outside of the volunteer system. They do that on their own time, but they still inhale the same toxic chemicals, the smoke inhalation, everything else that a career firefighter faces. which means they also have the same cancer risks. So what this bill does is it extends that to them, that cancer screening. And this is a no-cost screening. The counties can apply through a grant. If you look at the fiscal note, last page of the fiscal note, last paragraph kind of explains how that grant works. So it is no cost to the counties. When the bill was originally put in, it was passed through the Senate. There's something that the counties have for their volunteers to make sure that they're actually current and active called LOSAP, Length of Service Awards Program. Well, it turns out not every county has that. So we're asking for an amendment that there's actually a program, and the gentleman to my left can actually explain that through the comptroller's office that they use for the counties that do not have LOSAP to make sure that members are actually in good standing and are active so that they qualify for this, for both that and their retirement. So with that, I ask for a favorable consideration.
Thank you. Madam Chair, Madam Vice Chair, and members of the committee, my name is Chief Robert Phillips. I'm a 47-year volunteer in the state of Maryland. I'm here on behalf of this bill. It's a great bill. As alluded, we had the bill for the career staff that was passed, and the volunteers, we do have a program. You got the cancer screening program that we can make application to. I can tell you from a volunteer point of view, it's a very onerous application process. This bill makes it so much easier for our volunteers to be tested and screened for cancers. And the county has the right through the Maryland Department of Health with the Cancer Screening Program Fund to make an application to be reimbursed on this. This puts the county doing the administrative work. The volunteer fire service is doing what they do. They respond to emergencies. And it just makes it so much simpler. I tell you, this year was the first year in 3 years that we were able to actually have volunteer fire companies get grant funding through the Cancer Screening Fund. We proved a need. This year we had $800,000 in grant applications from the volunteers alone, where before in 2 years we only had one grant that was ever approved. This makes it so much easier for us to get screened. The senator was talking about the qualification process. The LOSAP program is not universal across the state of Maryland. Only some counties and municipalities have this program. An example would be in Dorchester County, where I'm from. I'm from the city of Cambridge. We have LOSAP. The entire state has an income tax modification qualifying program that is administered by the state, and you've got to do a certain amount of work throughout the year to qualify for this. You have to also qualify for 3 years before you can actually take advantage of the program for the first year. That would be about what I've got. I'll be ready to answer any questions you might have.
Thank you very much for your testimony, and thank you for this bill. Are there questions from the members? Let me start with Vice Chair Cullison.
Thank you, Madam Chair. Senator, and I'm sorry, your witness, I'm not sure, my name is out of the, Chief Phillips, thank you. In the amendments, are both things required, the 3 years of service plus the 50 points, or that's kind of how it reads, and I was wondering.
Well, you have to have the 50 points after 3 years. It's 50 points a year to be active, and then after 3 years, you then qualify for the program.
So the 50 points is not the LOSAP program?
No, ma'am.
Okay, that's my confusion.
Some counties have what they call LOSAP,
Right.
which is a different way to qualify through the points. Is it 50 points through LOSAP?
That's just length of service. You've been there for so many years.
So it's how they qualify. So some counties are actually, so LOSAP is, it's after 20 years, LOSAP is a retirement that a county will give you, and they give you, I think it's like $500 a year is what they give you, or a month, I think. I don't know. It's a retirement program, kind of like thanking you for your service after 20 years is what LOSAP is. But in order to get to the 20 years, you have to get the 50 points a year for 20 years to get you to that 20 years.
And every jurisdiction has that requirement of 50, has
Well,
that,
what I was saying is not every year, not every jurisdiction has that retirement program.
Right, but they do, but the 50 points
Every
is a measure
jurisdiction
that
does
every
have in order to
jurisdiction
get
uses.
the tax incentive, yes.
Okay, I think I have it. Thank you.
Yes.
Delegate Hutchinson.
Thank you, Madam Chair. Right? You called me, right?
Yes.
Oh, okay. They started looking that way. I was thought you know me, sometimes speaking when I'm not supposed to. Senator, thanks for bringing the bill. Looks like it's got great bipartisan support. I really have kind of two questions because I represent 4 counties on the Eastern Shore. This is enabling, or each county would be required, if this bill passes, to provide, because it looks like the counties are going to have to pay for this testing. Is that my understanding of the bill?
So the counties will offer it, but it is, again, if you go to the fiscal note, the counties are not paying for it. They apply to the state for a grant to cover it. Page 4, basically, the bill establishes that a county may satisfy the preventative cancer screening requirements by applying for a grant through the Professional and Volunteer Firefighter Innovative Cancer Screening Technologies Program, which for fiscal 2027 is funded.
Okay, great.
So
Thanks for clarifying that for me. Just one other, one of my counties, which was Wacomico, responded back and said that they had some questions about the definition of the volunteer, someone was actively involved in fire suppression. They have a definition that they use for a tax credit that they have within the county. You did mention about an amendment that sort of defined that.
We were going to use the amendment that the comptroller's office uses to
Which would-
define what a volunteer is.
Which I guess would be applicable to the tax credit definition that they may have.
I don't know if it's the same as your counties, but it's the one that our comptroller uses to define it for you to get it on your state taxes.
Great, thanks for the clarification, appreciate it.
And if I can just further clarify, that's already amended into the bill, correct? Is that page 2, lines 15 through 17, volunteer firefighter means an individual who is a firefighter actively involved in fire suppression and volunteering with volunteers? Is that the definition that you're referencing from the comptroller's office? The actively involved in fire suppression?
Yes, but I think we actually have the
amendment.
language from the comptroller's office, and I'll make sure I send that over.
Oh, okay. Okay, perfect,
I
thank
think
you.
we have the actual language from the comptroller's office we've been working on. Because what happened was after it passed out of the Senate, we heard from the
you got a
smaller,
response from the
from the smaller counties saying, hey, we don't have LoSAP, because originally that was the term we used because the counties I represent have LoSAP, and we realized some of these other jurisdictions don't have it. They're like, hey, we got to figure out for the other counties how to do it. So we worked with the comptroller's office, and they're the ones that said, hey, this is what we use statewide. Let's use that definition.
Perfect, so we'll just make sure that we've got the correct definition for consideration. Thank you. Delegate Hill.
Thank you, Senator, and Chief, always good to see you. Thank you very much for all the work that you do. I just want clarity. The grants that can be given to the local jurisdictions in order to provide these. So I think it's right. The volunteers need the same kind of screenings as the professional folks. The governor may put $1 million. I'm hearing that it's currently funded every year. Any idea of what the balance is based on what we've been doing with screenings for the professionals, or what happens if the governor decides, I mean, are we well above balance? Do we need to be looking at that number? Any ideas, Senator?
I know we put $400,000 this year. I don't have that number. I can go get it for you. But I know it's been a priority to make sure in budget tax we fund this.
So we're treating it as a priority at the state
We
level.
are, because
but
it
is a priority.
It is, because we know it's an issue for
Right.
firefighters. That, you know, cancer is the #1 leading cause of death for firefighters. And, you know, I was a volunteer for about 18 years. You know, if you're not wearing your SCBA, you know, when you're going in there, because you know, you can't wear that breathing apparatus all the time. You get an auto fire or something, and you're bringing that stuff in. It's unfortunately, it's starting to, you know, as people age, it's starting to become prevalent where people are needing to get tested. We're hearing it, we're seeing it, and that's why, and this was, you know, Jim Malone, as we knew him as Jimmy, you know, this was something he was passionate about. He knew about, he fought hard for making sure that, you know, his brothers and sisters in the fire service were taken care of before he passed, that this was passionate for him. So I know over on my side, in budget and tax, it's something that we have talked about. And we've made sure, because I've talked to Chairman Gazzone about it, because I did have this bill this year, making sure we had money in there. So I can tell you, while I'm over there, we'll be fighting for it.
Okay. If I may? I guess if you get that number, I think we're there now. I just want to know where it's a May, and I want to know that we're doing this for the future, and I don't want to see the rug get pulled out from under folks now that we're expanding the program. So it would just be helpful to know.
I will find out.
Thank you.
Delegate Kaufman.
Yes. Senator, it's good to see you. I always look forward to your birthday cards every year because they're so funny.
Thank you.
But my question is, does the Senate bill do anything to ameliorate the concerns of the State Council on Cancer Control, who was opposed to it at the time of the Senate hearing?
So they're opposed to it because they think there's other types of screenings that should be done. They're not in agreement with the type of screening that NFIB or it's basically the argument which screening should be done was their issue, is really what it came down to, was their argument. They have not, they're still, I think, in opposition because they think they should use another type of screening. They think there's more advanced, more technologically sufficient types of screening that could be done. But, as Delegate Hill just talked about, it's a financial issue. Hey, I wish we could do the top of the line screening for everybody, but unfortunately we can't fund every type of screening out there. We're doing the best we can for what we have. And that's what their opposition came down to, is they just think that there's other screenings out there that we could do. And it's just a disagreement between them and National Fire Institute.
Thank you, Senator. Good bill. Thank you, Madam Chair.
Thank you. Delegate Riley.
Thank you, Madam Chair. So, yes, Delegate, Senator, thank you for the bill. And as it passed, because I know, with the budget constraints that we're in, everybody has, some issues with that. But can you explain possibly, being a past volunteer firefighter yourself, how much monies we are saving our counties that have volunteer fire companies? And I don't think it's any kind of, what it would cost us if they were all paid, what that would cost each county, opposed to, I love this opportunity that it's a grant. And we want to make sure that the grant funds are enough for each county that applies. So would you have any idea how much that would usually cost for a whole department, or the chief?
I'll turn it to the chief.
Yes, ma'am, thank you. And we've done a lot of studies on this recently, just a couple months ago. If you can imagine a volunteer fire company going out of business, and I'm going to use Dorchester County as an example. We have 14 fire companies. If we were to have to staff with a career staff and just put one piece of equipment in each of the 14 stations, labor alone, the labor and wage benefit package for a 4-man crew, and we have shift rotations. So you work 24 and you're off 72, that's one of them. So you'd have 4 shifts of 4, and then you've got to have 1 or 2 extra people. But to answer your question, for every piece of equipment you put in service will cost you $1.3 million a year. That labor right now is being provided by the volunteers. Right. So in Dorchester County, and my commissioners aren't always happy with me, but I ask them where that bucket is with that $14 million in it when we don't have volunteers again.
Right. And volunteers currently are kind of hard to get at times, so I think this would be a huge plus, for our volunteers, and say, a little bit, thank you for what you do, and just in case we have this screening, and I get it, we would love to do more, but again, with, budget constraints, but I think this is a good way to move forward, and thank you, Chief and the Senator, for the bill. Thank you.
Thank you.
Thank you, Madam Chair.
Thank you. Seeing no further questions, thank you very much for the bill and for your testimony. And we will, and I will look at 1602 and see if we can.
Okay, thank you very much.
Thank you very much. This does conclude the bill hearing on Senate Bill 579. We are now going to move to Senate Bill 714. Senator Quarterman, you were on this bill, correct? Yes, ma'am. I just want to make sure that I was pulling the right bill. All right, Washington County Mobile Food Service Facilities and Semi-Permanent Food Service Facilities. Senator Quarterman, if you want to go ahead and begin your testimony.
Yes, thank you, Madam Chair, Vice Chair, members of the committee. For the record, Senator Paul Quarterman representing Washington Frederick counties today to present Senate Bill 714 on behalf of the Washington County Senators. This bill is Washington County specific. It provides regulatory clarity for emerging and non-traditional food service operations. It clearly defines mobile and semi-permanent food service facilities and updates how certain health requirements apply by helping to ensure the public health standards remain strong while recognizing how these businesses operate. So let me just kind of break it down how we got here, because it's to us, it's a fairly common sense bill. So it started in the summer. Our delegation was approached by 3 different businesses in our community, a coffee shop, a donut shop, and an ice cream shop. And what they all were, they are semi-permanent locations. When I say that, think of like what was once maybe a mobile, truck or RV, et cetera, maybe a food truck per se that was at one point mobile, but in a sense has been not mobile anymore. It's got a roof built onto it. It's got fences around it. It doesn't move. Almost like a mobile home once it's parked, it doesn't move anymore. It was kind of semi-permanent, but now it's permanent. So what happened is these different businesses, they had seating. Again, we're talking about a coffee place, an ice cream place, and a donut place. And so they had a picnic table. The coffee place had a couple stumps. So if someone got a coffee, they could go over and sit on a stump or sit at a picnic table, have their ice cream, et cetera. Well, that conflicted with our health code because it said that they had to have, since they had seating, they had to have lavatories and sinks and running water and all this stuff. And so subsequently, all 3 of them were shut down over the summer. An ice cream stand that had been there for probably 2 decades. A donut shop's been there for about a decade. Now they were allowed to reopen once they got rid of all their seating. But the challenge was, the issue was, why can't we have a picnic table when someone gets an ice cream cone? And so we tried to rectify this with our local Board of Health, which is our Washington County Commissioners. We also worked with the actual local health department. Their basic comment was like, this is the code. We have to enforce it what it is. However, if that was subject to change, obviously we would not be enforcing that anymore. And so that being said, this has been supported by our Washington County Commissioners, who again serve as our Board of Health. It was supported unanimously. It has unanimous bipartisan support from our delegation, and it was supported 42-0 on the Senate floor. So we are hopeful that you guys would find it in your hearts as well to help our ice cream stand, our donut shop, and our coffee stand. So with that, we would ask for a favorable report.
Thank you for your testimony. Are there questions for this witness? Delegate Johnson.
Thank you, Madam Chair. Thank you for bringing this bill. Would this in any way, because I see it defines mobile, so once they're becoming stationary, does this any way create an unlevel playing field for your brick and mortar places that you have in the county?
Well, see, I guess that is the part of the issue, right? Because if they are mobile, per se, if it was a food truck, they don't have to have those things. You can have a food truck, you can park a picnic table right outside of it, doesn't pertain to them. But the fact that now that they have, built in, an awning and things of that nature, that's where the kind of the debate comes about, right? At the same time, I would debate that also when you have permanent locations, like any drive-through facility, McDonald's, Wendy's, whatever, and you go through the drive-through and you get your food, you're eating in your car, doesn't matter about what lavatories are or not, because you've made that choice as a consumer. And so we just feel it seems to be common sense that if you're going to get an ice cream or something like that, you want to have seating, you should be able to do that. And that's where the code conflicted. And again, this is just Washington County specific. We looked at it statewide, but we understand that every jurisdiction has their own issues and things with zoning and things like that. And so that's why we kept it specific to our county, as we recognize that was the issue. And everyone, the locals are all on board with it, so.
Okay, thank you. Thank you, Madam Chair.
Delegate Hill.
Thank you. Delegate Wyville and the delegation have, sort of explained. I just want to be clear to Delegate Johnson's point. These are places that have outdoor seating or tented seating. And at the point that the preparation space becomes big enough for indoor, it's no longer applying. Is that a distinction that's not in the bill, but that you're really talking about?
I think if I understand it correctly, it's yes, because the preparation area is inside the what used to be, I guess, a mobile truck or whatever, right?
But there are
And-
no seating inside. The
Correct.
seating's
No,
all on
no
the
seating.
outside.
Customers don't go inside. There's no one who's allowed inside that facility except for the employee who's preparing the food. The seating literally was just a picnic table that was outside under an awning, and in the coffee stand thing, they had literally stumps, cut off stumps that people just sat around. And so, yes, to answer your question, if that helps.
So local people should be clear that that's not the same, and it doesn't make it
Correct,
unfair.
yeah,
Okay.
exactly. That's a very good point. I appreciate you saying that, Delegate. You can't actually enter that facility like you would a traditional brick and mortar restaurant per se.
All right, thank you.
Thank you. Seeing no further questions, I just wanted to get your take on the letter of opposition from Macho.
From who was that?
There's a letter of opposition just stating that this is in conflict with the International Plumbing Code from 2021. Are you aware of this, and do you have a response? I'm just a little surprised to see the opposition.
I am too, and I do apologize, Madam Chair, because I did not
That's all right.
see that.
I'm not trying to throw you off.
No.
I know that we had thought earlier on that there was a departmental that addressed this, and then, discovered that it wasn't addressed in the departmental because it was county specific. But
Right.
if you don't have a response, that's okay. I would just refer you to the letter and we can have our council review.
Yeah, I'll
to
go back
make
and look,
sure
and
it
I
doesn't run out.
apologize, because from my understanding, when we presented the Senate, I did not have that letter of opposition then, so that's on me if I didn't see that, so I do apologize on that. Just based on what you've just said, the plumbing, I would imagine they're advocating for plumbing. I mean, but yeah, I mean, again, we've run it up the chain through the health department and things of that nature, and there's no opposition from the health department, so I would hope that would be satisfy the will of the committee.
Well, thank you very much, and thank you for your testimony. This does conclude the bill hearing on Senate Bill 714. We are now going to go to Senate Bill 820, which is Alcohol, Tobacco, and Cannabis Commission Unauthorized Consumable Products. This is Senator Hayes. So if you want to come on over and give us your testimony.
Awesome. Thank you. Good afternoon, Madam Chair, Madam Vice Chair, and members of the Health Committee. For the record, my name is George Reith, and I serve as Legislative Director to Senator Antonio Hayes. I'm here today to present Senate Bill 820, the Alcohol, Tobacco, and Cannabis Commission Unauthorized Consumable Products Enforcement and Seizure. Senate Bill 820 strengthens Maryland's ability to protect consumers from unsafe or unapproved consumable products that are currently being sold in retail environments. This bill's crossfile has already been heard in the committee, and to save your time today, I urge a favorable report, and I look forward to working with you all to have a good product.
Thank you very much for your testimony. Are there questions from the members on this bill? Are you aware of any differences between how the bill came over from the Senate and how it passed over from the House?
Yeah, we're aware that there are some differences, and we look forward to working with you to have a good product.
Perfect, and my counsel just said, we're working on it, so I think we all are aware. So thank you very much for your testimony. This does conclude the bill hearing on Senate Bill 820. We are now going to go to Senate Bill 892. This is Health Occupations, Public Health and Insurance, Menopause Provider Training Coverage Requirements, Policy Initiatives, and Access to Care. This is Senator Guile. Michael, welcome to our committee. You can begin your testimony when you're ready.
Thank you. Good afternoon, Chair Bagnall, Vice Chair Cullison, and members of the committee. For the record, Mike Cardozo on behalf of Senator Dawn Guile, District 33, here to present Senate Bill 892. SB 892, as amended, is identical in posture to House Bill 1365, sponsored by Speaker Pena-Melnick. SB 892 and HB 1365 have both passed in their respective chambers. This legislation ensures that Maryland patients have insurance coverage for the evaluation and management of menopause and related symptoms, while expanding clinician training beyond OBGYNs to improve care across the system. It directs the state, in partnership with the Maryland Commission for Women and Department of Health, to develop training, improve access to care through coordinated policy and outreach efforts, and reduce the stigma around these issues. The bill reflects updated clinical standards and builds long-term infrastructure to better support women through perimenopause, menopause, and postmenopause. With that, Madam Chair, I respectfully request a favorable report on Senate Bill 892.
Thank you for your testimony. Are there any questions for this witness? Seeing none, thank you for your testimony today. Say hello to the good senator for me, my senator. This does conclude the bill hearing on Senate Bill 892, and we are now going to go to Senate Bill 496. This is Maryland Medical Assistance Program coverage for the treatment of obesity. Do we have someone on this bill? Okay, so then we will go to Senate Bill 866, Public Health, Chain Restaurants. Do we have anyone here for Senate Bill 866? I assume then not Senate Bill 159 either. All right, how about Senate Bill 898? All right, this is Maryland Medical Assistance Program, Registered Behavior Technicians Reimbursement. Senator McCray, if you want to come to the table, and you can give your testimony if you want to bring your witnesses as well.
Good afternoon, Madam Chair, members of the committee. For the record, my name is Gregory Baugh. I'm an intern working for Senator McCray, who sends his apologies for his absence. And we respectfully request a favorable vote for Senate Bill 898, legislation that expands access to essential behavioral health services for individuals with autism spectrum disorders by requiring the Maryland Medical Assistance Program to reimburse applied behavior analysis services provided by registered behavior technicians. Applied behavior analysis is a widely recognized evidence-based therapy used to support individuals with autism spectrum disorder in developing communication, social, and behavioral skills that are crucial to daily functioning and long-term independence. Senate Bill 898 ensures that services delivered by registered behavior technicians who work under the supervision of licensed psychologists or board-certified behavior analysts are eligible for reimbursement through Maryland's Medicaid program. By recognizing the role of registered behavior technicians in delivering ABA services, this legislation helps expand the behavioral health workforce and improves access to care for families who rely on the Maryland Medical Assistance Program. The bill also provides flexibility by allowing technicians to obtain required professional certification within a reasonable time frame after beginning service delivery, helping reduce barriers to entry while maintaining quality standards. This bill was passed in the Senate, and the vote was unanimous. We respectfully hope for a favorable report for Senate Bill 898.
Thank you for your testimony. We'll tell the good senator what a great job you did. Who's next?
I'll go next. My name is Brittany Rader. I'm president of Clinical Services, and I'm a board-certified behavior analyst. Our organization provides behavior therapy to kids diagnosed with autism in DC, Maryland, and Virginia. We currently serve about 800 kids across the region. And I'm here today to ask for a really simple change, which is extending the window from 90 days to 150 days. The proposal does not change the certification requirement, and it does not lower standards. Every technician would still have to pass the same exam and meet the same supervision requirements. What it does is it gives hardworking technicians a realistic amount of time to complete the requirement while continuing to support children and families who rely on them. In behavior therapy, we know that consistency matters. Children build trust and make progress through stable relationships with the technician that works with them every day. But under the current 90-day limit, when a technician hasn't yet passed the exam, providers are often forced to rotate uncertified staff onto cases just to keep services going. That means a child could see multiple technicians in a very short period of time. Extending the window to 150 days allows one technician to stay with the same child longer, which is better for progress, better for families, and better for the healthcare system. It's also important to understand what the exam is and what it is not. The RBT exam verifies a baseline competency. It's not where technicians develop their clinical skills. The development happens through hands-on training and supervision by licensed clinicians who are required that throughout this period. So clinically, extending the window doesn't change care quality. It simply allows technicians more time to schedule and pass the test. The proposal is not about lowering standards. It's about supporting the workforce, preserving continuity for children, and ensuring equitable access for families. Extending this window is a small administrative change, but has a real impact on stability. Thank you for your time and consideration.
Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. Obi Chinamera on behalf of Behavioral Framework. 3 quick notes. One, As you've heard, the main goal is this is just taking the time frame from 90 days to 150 days to allow for more time for people to get certified. Second, I want to address a comment that was made in the physical note. Department of Health says that about 1,200 RBTs are going through the process. About 28% of them had been certified. Therefore, they felt as if the amount of people being certified or people who were doing trainings weren't fully certified. Our argument is that this bill actually is to address that. The problem isn't that these people aren't qualified. The problem is they're not having enough time to actually get certified. So if they had more time to go through the exam process, to go through the training process, they'd have a higher rate of people being certified, which would be better for the actual families. Lastly on that, we have a couple of things that would have to be changed in the bill. Amendments are being worked on. Bless you, by the way. One of them is just technical, and then the other one is we spoke with the Department of Health about some of the concerns they may have, and they want to offer an amendment, and we were absolutely happy to allow the amendment after talking to them, which will hopefully alleviate some of the concerns they have about putting this through. So with that, we think this is a common sense bill. We thank the committee for taking the time to hear it, and we'll open any questions if you have them.
Thank you very much for your testimony. And is this your first time testifying in front of our committee on behalf of?
Yes, it is.
All right. Then I'm going to open it up for questions. Are there any questions for these witnesses? Are there any actual questions for these witnesses on this bill? Delegate Hill.
Thank you. Thank you. Now, I'm reading two testimonies that talk about amendments, and I'm hearing different amendments being offered, right? So I want to make sure I'm clear. There's one about specifying which organization is overseeing and making the determination of certification, which is sort of separate from others that we do where we'll say, we'll name it, and then we'll say, or another organization in case another comes up, but you don't want there to be another one. So we'd have to come back to statute if another.
Thank you for the question, Delegate. The way that the current agreement would be that we would essentially allow it to be decided in regs and let the department make the decision as to which certifications are allowed. That way it wouldn't be in statute because you'd have to change to add one or not. So we let the health department decide. If they feel as if one board or credentialing body is able to do the work, they should allow them to do it.
And the second one is for Spanish access to the test.
Yes, so that amendment currently is not going to be
Is not going to be offered.
Yeah.
Okay.
There was, and open, happy to have some conversations with you guys, happy to, but we understand that the department has some issues with trying to make that happen, but they're willing to work with us on
Okay, so
figuring
the
it out.
other one that's not in our testimony, but I've heard about is the hours that you testified to. And then there's a third one, previously fourth one from MDH that addresses some other issue that you're not able to.
Just federal preemption, making sure that if the federal government, since this is a Medicaid program, has some concerns or something that they're being asked to do, that they can follow that order.
Okay, thank you. I just needed to be clear. I'm sure council is clear. I just needed to be clear. Thank you.
Absolutely, no, thank you.
Delegate Johnson.
Thank you, Madam Chair, and thank you for coming to explain the bill to us. So I'm looking here, and it says, if you can clear this up for me, prohibiting them from getting reimbursements until they receive a certain certification. So what if they're reimbursed for services and then they don't get the certification?
So the way that the current, thank you for the question first. The way that the current system works is that when a when a company like Behavioral Framework or another RBT company hires a registered behavioral therapist, Maryland Medicaid gives them 90 days from the start of their hire to be able to bill their services. After 90 days, if you do not have that certification, you essentially can no longer bill Medicaid. Two things happens. Either one, you have to move that person to a different case, which most of them are Medicaid clients, or second, you have to let them go. And then you would bring in another person who has 0 days in to start that process and see if they can get allowed in 90 days. What we're saying is that the 90-day process isn't long enough or isn't long enough to give people enough time to actually go through the full process and exam and the testing. So this would actually give them just 60 more days to complete that certification before they get cut off, if that answers the question.
Follow up, Madam Chair. Okay, so we're going from 90 to 150.
Yes.
So now we've expanded the reimbursement they've received. So what happens if they don't get certified?
Then the same thing would happen that happens now. They would no longer be able to
What happens
bill.
with the money they got reimbursed for?
Well, no, the reimbursement's for services. So they were doing a service that was paid for. Nothing would change except for the fact that after 150 days, they would be cut off, but they still did the work, so they would still be getting reimbursed.
All right, thank you. Thank you, Madam Chair.
Yeah, no problem.
All right, seeing no further questions, thank you very much for your testimony. This does conclude the bill hearing on Senate Bill 898, and we are now going to turn to Senate Bill 496. This is Maryland Medical Assistance Program coverage for the treatment of obesity. Senator Hershey, if you want to come to the table and give us your testimony. Thank you.
Thank you very much, Madam Chair, Madam Vice Chair, members of the committee. For the record, Senator Steve Hershey to present Senate Bill 496. Obesity is a chronic complex medical disease, and it is one of the primary drivers of healthcare costs in Maryland and across the country. Chronic obesity is linked to some of the most expensive and debilitating conditions we treat every day in our Medicaid program. Type 2 diabetes, heart disease, stroke, high blood pressure, sleep apnea, joint disease, fatty liver disease, kidney disease, and certain cancers. These are not abstract risks. They are the conditions that lead to hospitalizations, disability, long-term care, and premature death. Senate Bill 496 takes a practical and forward-looking approach. The bill does two things. One, authorizes the Maryland Medical Assistance Program to provide comprehensive coverage for the treatment of obesity, including FDA-approved medications for chronic weight management. And two, if the department chooses to offer that coverage, it simply requires that Medicaid recipients are notified. Let me be very clear about what this bill does not do. It is not a mandate. It does not force the department to cover any specific treatment. It does not override utilization management or clinical guidelines. And importantly, because there is no mandated coverage, there is no fiscal note. The Senate Finance Committee is currently in possession of the House cross-file. This bill passed unanimously in the Senate, and I ask for a favorable committee report. Thank you.
All right. Questions for the sponsor, Delegate Morgan.
Thank you, Madam Chair. Good to see you, Senator.
You too, Delegate.
Hey, I just wanted you to address, you said there was no fiscal note.
Correct.
But in the fiscal note, it says the estimate as much as $449 million annually to cover anti-obesity medication.
That would be if Maryland Medicaid chooses to offer this coverage. What it doesn't do, though, is talk about the offsets. What it doesn't, and also just to be clear what that fiscal note does, again, because it's not a mandate, so they are providing some projection. They also gave two different numbers, right? They gave $225 million if there was a 15% uptake, and they gave $449 million if there was a 25% uptake. Most of the states that we took a look at already have an uptake of about 3 to 7%, so dramatically lower than what the fiscal note says here, and even lower than their first estimate. What it doesn't do is talk about the offsets. So again, I look at this as a preventative issue. That's something that can go up. And I'm sure at this point in time, many people know somebody that has been on one of these GLP-1s. And outside of weight loss, one of the first things that you hear from them is, I'm off of these medications. Went back to the doctor, he took me off of high blood pressure. He took me off of heart disease, stroke, all different types of medications that were out there. So unfortunately, when the fiscal note writers put this together, they weren't able to kind of do that balance and say, if you were to provide this coverage, what we would expect to see in savings. But just in one thing alone, we talked about this on the Senate floor, type 2 diabetes, Maryland's Medicaid spends almost $5 billion annually on type 2 diabetes. So, even if this was the high end and we were able to see 10% that don't have to have the type of type 2 diabetes coverage, again, even though it's not a mandate, I would think that this is certainly offers some savings to Medicaid.
Well, is there parity between, does any other private insurance company offer cost savings, I guess cost sharing for these GLP-1s if it's for weight loss?
For chronic obesity management? Yes.
Sure.
Obviously, there are a number of private sector policyholders that are providers that are doing this. Also, local governments are starting to do it as well too, and also companies are starting to do this in their as an offering as well too. Again, what they've looked at is the absentee rates, people that are out for other types of sicknesses, and that has gone down dramatically in reasons why some private sector companies have decided to offer it as well.
Thank you. Thank you, Madam Chair.
Delegate Hutchinson.
Thank you, Madam Chair. Thank you, Senator, for being here today. I want to see if I understand this bill correctly. So today, Medicaid is not even isn't even authorized to provide a GLP-1 for obesity treatment. So what this bill is doing at least gives them that authority to provide it in the onset that, let's say, there's an incredible reduction in cost of a GLP-1, or there's a true cost-benefit analysis that says, hey, we have proven that someone going on a GLP-1, although there's a cost associated with it, there's much savings. This is simply authorizing Medicaid to be authorized to do this. Is that my understanding in a nutshell of the bill?
Right, to request that Medicaid covers this. Yes, all of those points are correct. And actually, this morning on Today's Show, NBC, they talked about the price coming down for the GLP-1s, and they've also talked about that now becoming, rather than a shot format, a pill format as well, too. I think they were talking about Wegovy, or at least that was on the screen. But they are now also seeing a lot of manufacturer-to-consumer direct programs that are out there because these things are working. I do want to say Medicaid currently provides behavioral therapy and bariatric surgery. Okay, so one of the most invasive procedures that are out there, bariatric surgery, Medicaid has decided to cover. So again, I think that they have gotten into recognizing that the management of chronic obesity is something that needs to be done. These GLP-1s obviously are fairly new on the market, obviously last 5 years or so. And I think, again, this bill's been, unfortunately, in the General Assembly 3 years in a row. The first year we brought it in, we did mandate coverage. And we were given, this exploding type of fiscal note. The second year we brought it in, we required Department of Health to do a better fiscal analysis of this, which they did. They provided at the end of the year before last. And so this year we came in and just said, we want to keep the ball rolling on this, and we really want the experts at Maryland Department of Health to make the decision. And so we are saying through this legislation, if we're able to pass it, that the General Assembly does think we should go in this direction. But we want the experts at MDH to come back and say that this is the right way to go.
Thank you for your time.
Thank you.
Delegate Martinez.
Well, first I want to say thank you, Madam Chair, but also great bill, Senator.
Thank you for being my cross-file. I appreciate that.
Of course. I also wanted to just ask, this is just simply enabling, correct, legislation?
Yes, it is.
Thank you.
Yes. Thanks. Thank you as well.
Seeing no further questions, thank you very much for your testimony and for the bill. This does conclude the bill hearing on Senate Bill 496. Thank you very much. We are now going to go to Senate Bill 866, which is the Public Health Chain Restaurants Disclosure of Notice to Customers of Sodium and Added Sugars. This is Senator Washington, and then we'll go to your other bill after that.
Thank you, Madam Chair. And before I begin, congratulations. I'm sure you heard lots of that last week and this week, but congratulations on your new role. For the record, Senator Alonzo Washington here to present on Senate Bill 866. This is a really great bill that you have already heard many times, that you worked really hard on already, so I'm not going to talk too much about it. It's a bill that is just about transparency when it comes to sodium and sugar in our meals for chain restaurants that exist here in Maryland. That's it. That's all it does. We want an icon and some information so folks know what that is and what it looks like. This bill was amended. That's amended differently from the bill you sent over from here to the Senate. This bill requires a QR code only on the menu. Your bill would have required a QR code and the icons that show that over that percentage of time. This is a great bill, especially for families that really rely on fast food at times or different meals in any case. Doesn't have to be fast food meals, but these are chain restaurants. I mean, they already have this information. This is happening in other jurisdictions, as you all already know. It's a simple bill. It's about transparency in what our food is, and we should all know. I mean, I want to know. For those reasons, Madam Chair, I ask for a favor report on this bill that you already moved in a great posture.
Thank you very much for your testimony. Let me open it up for questions from the members. Delegate Hutchinson.
Madam Chair, thank you, Senator. Just a point of clarification, because I was aware that on the Senate side, it was just the QR code, which I think a lot of the chain restaurants supported, as well as the Restaurant Association supported. So is that what you're advocating for, that we stay with just the QR code as it was amended? Is that what I'm hearing?
No, what you're hearing is that this bill is at the will of this committee, and if the committee seems that they want to change it back to the posture that that they sent it out, I'll be on the other side rooting you on.
Thank you, Senator. Thank you, Madam Chair.
Thank you very much, and thank you for the clarification. Seeing no further questions, we do have another question. Delegate Johnson.
Thank you, Madam Chair, and thank you, Senator, for the bill. The bill in your posture, do the restaurants feel that will be less costly for them with just the QR code instead of changing the icons on the menu when they change the menu?
Well, they have to change the menu still in order to add this QR code. So I think the additional costs would vary, obviously, but the QR code would cost probably just as much as it would in the posture that you all have sent it over. Because you're asking for a QR code and a icon. So this bill says a QR code. I'm not sure the cost savings that they believe that they're going to have. This bill and the bill that you sent over is about, that initially came here, was about transparency in this food that's folks can consume.
Follow up, Madam Chair. With a QR code, they would be able to change that one place electronically, correct? And not have to change the whole menu?
They will have to change that QR code, that one place. Yes, sir.
Okay, thank you. Thank you, Madam Chair.
Seeing no further questions, thank you very much for your testimony. This concludes the bill hearing on Senate Bill 866. We are now going to go to Senate Bill 159. This is medical services, vehicles, and ambulances required supplies. Senator Washington.
Yeah, thank you, Madam.
And you don't have a panel on this one?
I do not. No,
okay.
I do not.
So you can begin your testimony.
Thank you, Madam Chair, members of the committee. For the record, Senator Alonzo Washington here to present on Senate Bill 159. This bill is a really interesting bill where, during the summer months, I've heard of families, and including my family, when they call the EMS vehicle to their home, the EMS vehicle will show up, and sometimes in my case, did not show up with any neonatal care to be able to monitor a child on its way from my home or their home to the hospital. A lot of EMS vehicles here in the state of Maryland do not have that neonatal care for just monitoring a child for when they come from one place to another to make sure that they're stabilized in that vehicle. It's really important that we have this. This bill was amended heavily to take out the opposition from all the other folks that believe that this was, not amenable for them or too costly for them. And so we amended it so that it's just so that NIMS, the agency that oversees all the EMSs here in the state and conducts a lot of their training, will coordinate, along with the other coordinating that they do amongst any other equipment, neonatal equipment, and what that minimum requirement would be. This bill does not stipulate what that requirement is and what the equipment would be. It says that they will work in conjunction with others across the state and across the country to determine what are the best tools to have used and equipment within these EMS vehicles so that a child and a parent will feel comforted when they're calling 911 in their time of an emergency. You only call 911 for a child when it's an emergency. And you want that child to feel safe, and you want those parents to feel safe that when they transport from one place to another, that they have the equipment that's there. There are a lot of EMS vehicles in the state that do not have this equipment. This will make sure it's there. So I ask for a favorable report on this very simple bill, and all the opposition has been extinguished because of the amendments that we added to this bill, Madam Chair. Thank you very much.
Thank you very much for your testimony. Are there any questions from the members? Let me start with Delegate Riley.
Thank you, Madam Chair. Thank you, Delegate Washington, for the bill. So I still have, even since the bill has been amended in the Senate, I still received an email from, I represent Hartford and Cecil. Hartford County government has sent in a letter still of opposition due to, the mandated funds that this is going to be on local jurisdictions if this equipment has to be in every single vehicle. And that brings me to the next question and the email that I received from Cecil County, from the Maryland State Firefighters Association EMS Committee, the chairperson of that, and then also in agreement, the Metropolitan Fire Chiefs Council. MACO and MML. So there's still a lot of opposition to this bill. And one of their main questions was the interpretation. It's just too vague of what's in the bill when it says, fire service, by saying all emergency medical service vehicles is left up to interpretation due to the fact that we run fire engines, ladder trucks, brush units, utility vehicles, on all pretty much medical calls as first responder units. So it could be, very, very costly if the interpretation is from someone to say, well, since it says emergency medical services, does that require all of those particular vehicles to have this equipment? Because generally it's on the main, like a, what do you call it? Like an SUV, the chief's, engine or chief's vehicle that goes out to the calls as well. Would it be sufficient if it was just in that vehicle that's going on the call, or does this bill require every single piece of equipment to have this on board?
So let me make something very clear. So this bill is literally one section and a complete sentence. It says coordinate the minimum equipment, supplies, and medications, including equipment, supplies, and medications needed for neonatal care, that's for children, to be available on emergency medical service vehicles with federal, state, and county governments. It doesn't say all emergency vehicles. It says emergency medical services vehicles. Those are vehicles that show at your home, that show up to your home with the equipment that they are, with a lot of the telescopes and the needles and the EKGs. Those are the vehicles we're talking about here, not SUVs or fire engines. These are EMS vehicles that we're talking about that typically would have adults equipment on there. What we're saying is that under this bill, they're coordinating what that minimum equipment would be. There's not any stipulation here that says that it should be this equipment placed on here. Now, if vehicles already have this, then they're null and void. This doesn't matter to them. But there should be some coordination at the state level that would require all of the EMS vehicles, no matter where you are in the state, that if your child is in a state of an emergency, that vehicle should show up with the equipment necessary to monitor that child. We're talking about a 9-month-old, a 1-year-old, a 2-year-old. And if they're saying it costs too much to have neonatal care, I'm gonna need them to change their goals and mission, because they're there to protect everyone, no matter what age they are. And this is a bill about kids, about ensuring that young people feel safe when they get on these vehicles and they're able to be monitored. This bill has been amended to take all those things out. Nothing in this bill says all emergency vehicles. It only says EMS vehicles.
But all of these are EMS vehicles, so that's the problem. That's why it's just too broad.
That's not true.
Okay.
That's not true. According to MIMS, EMS vehicles are the ambulances that are equipped for transporting a human from one place to another. It's not a
It's
'Cause
not
they
a
say that
fire,
they
it's not a
have
fire
these.
engine, it's not a truck, it's not all these other places that you're referring to. There's a formal definition of an EMS vehicle that exists in current statute.
Can you possibly send that to me?
I can, and I
Say
did.
if we can, we can get that definition,
Yeah,
we can make
perfect.
sure we
Great.
share it with the full
Thank you, Madam
committee.
Chair.
Because that would make it clear. Thank
Fair
you so
enough.
much.
Thank you,
Appreciate it.
Delegate. Appreciate it. Thanks for the question.
Thank you very much, Delegate Riley. Let me go to Delegate Hill. And also, I just wanted to say, Senator, that the term delegate is a term of affection in this chamber.
Fair enough.
Delegate Hill.
Sure, thank you, Madam Chair.
It's all good.
So Senator, I just want to be clear of what I'm seeing, given Delegate Riley's point. What I'm reading is coordinate the minimum equipment, supplies, and medications, including equipment, supplies, and medications needed for neonatal care to be available on emergency medical services vehicles with the federal, state, and county governments. Am I correct that there's nothing here that says that when they coordinate, they have to say that each vehicle has to have the exact same stuff? They have the freedom to say, if you've got two different kinds of vehicles, this one has to have that, some other vehicle has something else. So they have a lot of latitude to take into account all the concerns about the cost and the needs and the demand for the equipment. Is that a fair understanding of?
Yes, that's very fair. Thank you for that, Delegate, using it as a term of endearment. They're coordinating that with the locals and deciding what should be the policy. And so if the locals feel like, okay, it's better to have this type of equipment, or just this is necessary, or this type of equipment is necessary and feasible for the financial stability of that unit or of that place, then yes, they will coordinate with that.
All right, thank you.
So thank you for that.
Madam Chair.
Thank you. And Senator, would you be amenable, because I do recognize the concern
Yeah.
if we add clarifying language that
Sure.
just says that,
Absolutely.
it doesn't require it, that it's a coordination. All right, thank you. Delegate Shalega.
It says coordinate.
Thank you. Good to see you.
Yeah, I know.
Welcome back to
Good
the
to see you.
House.
Thank you.
So I'm reading the bill, and I heard your testimony, and the bill says neonatal care. So that's infants to like 4 weeks old. But then your testimony talks about like toddlers. So help clarify where you were going with this.
Yeah, I'm referring to, look, the purpose of this bill is to make sure that these vehicles that serve our residents have the equipment for every age, no matter if they're newborn to age 100. So if it's someone that's 1 week old to a toddler, they should have this. If they should have it on here. Neonatal care is because what I've learned through my research is that not all of the units have that type of equipment on their vehicles, and I believe that it should happen, and it should be coordinated by NIMS, the appropriate agency, to conduct a survey to determine what that equipment is.
Okay, just so you know, neonatal does mean a newborn. So you may need to tweak the language as well if you're really looking to encompass more than a newborn. Thank you.
I'm okay with neonatal, honestly. Yeah.
I was going to say, because we also have neonatal and perinatal.
Yeah.
So we just want to make sure that we are capturing the
I appreciate the thoroughness
your
of this
intent.
committee. Thank you.
Are there any other questions from the members? Seeing none, thank you very
Thank
much
you
for
very
your
much.
testimony. Thank you for bringing this bill and giving us the opportunity to get our questions answered. And welcome back to the House chamber. This does conclude the bill hearing on Senate Bill 159 and actually concludes our bill hearings for today.